Welcome back. Today we will discuss a tool you can use to screen patients for cognitive impairment. It's called the Mini-Cog. Keep in mind that screening tests are used in patients without a specific complaint. A great time to do Mini-Cog screening is during a patient's annual physical exam or if you use the Medicare annual wellness exam. It can fit well into that visit too. The Mini-Cog is a quick and easy to administer test consisting of two specific cognitive tests. First, a 3-item recall testing short-term memory, and next, the clock draw test of executive function. So in 3 easy steps, both areas are tested. Let's next look at each step in detail. Step 1 is the 3-item registration. We want to be sure the patient has heard the words clearly and understands the instructions to remember them for later. Here's how I say it. Mr. Jones, please listen carefully. I am going to say 3 words that I want you to repeat back to me. I'm also going to want you to try and remember them for later. Let me say all 3 words. Here they are. Banana, sunrise, chair. Okay, now your turn. Please repeat the words I told you. Step 2 is the clock draw test. Here's how I instruct them for this part. Mr. Jones, next I want you to draw a clock for me. First, put all the numbers where they go. When that is completed, I say, now set the hands to 10 past 11. Here are some clinical pearls to keep in mind for this part. Remember that this is partly to cause a distraction for the recall test, but it is also a highly valuable executive function test that is commonly more challenging than it appears, and early trouble can sometimes show up in minor issues on the clock test. The Mini-Cog uses a pre-printed circle, so the patients are really being tested on completing the numbers and setting the hands of the time correctly. Remember, this is not a memory test, so if patients ask you to repeat the instructions or repeat the time, that's perfectly fine in this situation. There is a time limit here, so stop after 3 minutes and score accordingly. Finally, step 3 is the 3-item recall. Say to your patient, Mr. Jones, what were the 3 words I asked you to remember? Then note which words they can remember and which they do not. Keep in mind they do not have to give the words back in order, similar to what you said. Now for scoring. The maximum score for the Mini-Cog is 5 points. For word recall, 3 points is perfect. You give points for words remembered spontaneously, 1, 2, or 3. For the clock, 2 points is the maximum. Using the Mini-Cog form with a circle already on the page, you give 1 point if all the numbers are placed in the generally correct position, anchored in the usual spots by the 12, 3, 6, and 9. There should be no duplications. There is also 1 point for the correct time being identified as 11:10. Hand length is not evaluated in the Mini-Cog. Scoring the Mini-Cog is fairly straightforward, as you've seen, but interpretation of the score comes with one very important caveat. First, let's look at the low scores. A cut point of less than 3 has been validated as positive for dementia screening. So patients scoring 0, 1, or 2 are advised to be sent for further evaluation either with you or referred out. Patients scoring 3 or more are scheduled for annual screening. This is where the important caveat comes in when using the Mini-Cog. If a patient has a high baseline intellect, you may actually be concerned if they score anything other than a 5. And you may see them score a 5, but watch as they struggle with the short-term memory or executive function test. If because of that qualitative performance, you feel this testing represents a change in intellect, you may then want to move them into the positive screening category, having them get further evaluation with you or be referred out. Here are 2 important clinical pearls to keep in mind as you evaluate the Mini-Cog results of a patient. The early stages of this illness can be very subtle and hard to detect, especially in highly educated people. The higher the baseline intellect of your patient, the higher the cut point you may need to have to gain appropriate sensitivity of the test. Less than 4, or even the presence of any error, may be the more appropriate cutoff for highly educated and intellectual individuals. And keep in mind the AD8 we learned about earlier. It can come in handy here. If screening is positive, and by definition screening is for patients who are not complaining of a symptom, it could be useful to have them get a loved one to complete the AD8 to assess for any observable change. I hope you've come to see how valuable the Mini-Cog can be in screening for dementia, but no screening test is valuable if it can't be easily done within a busy practice setting. So here are some thoughts about how you can do that. First, consider training your medical assistant to complete the Mini-Cog. There is a great how-to video at Mini-Cog.com that can help do their training. Then you can work this into their annual physical or Medicare annual wellness exam. Consider keeping Mini-Cog and AD8 forms in your rooms for easy access. Next to those forms, keep some patient education materials about brain health so that you can provide that information to every patient who gets screened. And lastly, schedule patients who screen positive for another appointment with you for further assessment or plan for their referral. Thanks for taking time to learn about screening for dementia with the Mini-Cog. In a disease that is slowly developing but ultimately devastating, screening asymptomatic patients can be valuable. We know that it's helpful in identifying patients earlier, and that sort of earlier identification is helpful getting them into treatment plans or even clinical trials, and ultimately preparing them and their family caregivers for the challenges of this difficult illness.